All right. Hello and welcome back. I'm Eric Sunset, your host of the DocBuddy Journal. This is episode 43. We're recording it on Friday, November 10th, 2023. We've got a very special guest today. We've got Oakkar Oakkar, CEO of Keona Health. For those who may not be familiar, Keona Health is the healthcare CRM that harmonizes patient access and allows you to be the healthcare provider patients want and need. Oakkar, thanks for joining us today.
Thank you, Eric.
And I understand that you're based in Washington, D.C. What else should listeners of the pod know about you?
Oh yeah, so entrepreneur at the core, software development background, and of course, any software developer love solving very difficult problems and very passionate about turning an idea on a piece of paper into a product that being used by millions of people. Right, that's what I thrive and live for. And been doing this for a while. This is 13 years into Keona Health, and the idea that we have to solve difficult problems. There's no shortage in healthcare, right? So we pick the best field to do what we set out to do. A little bit of background: I was born in Burma. Had a big inspiration to become an American entrepreneur. This is from reading Bill Gates books and Steve Jobs, and it's my dream, just to do something impactful like that. And I'm very grateful that I'm living the dream every day. So grateful to get up in the morning and do what we do. So very stoked to be here talking to you, Eric.
Yeah, oh my gosh, same here. And after hearing that, I didn't know that about you. I mean, that is, what we would like to call the American dream. There's opportunity at every corner, and in healthcare, there's more than opportunity just at every corner. There's opportunity to optimize, there's opportunity for efficiency gains essentially every step of the way. So if we can want to take a look at the role of technology in healthcare, and it won't be news to you, but for some of our listeners that are maybe newer to the space or don't have a good understanding of why we're talking about technology in healthcare at all, we're coming up on about 15 years of the advent of the ARRA 2009 that had the High Tech Act that had all of our meaningful use incentives and penalties at the outset, and we've obviously since evolved from there, but you ended up with a bunch of second order consequences for technology foisted on providers where maybe we didn't know exactly what we were doing. And I'm kind of being generous to our friends in Congress there. Not only did they not know, I don't think they had any consideration for what they were doing. So let's take a positive spin on it. What's the role of good technology in healthcare? Either what it is or what it could be.
Yeah. So Eric, you have a deep background in healthcare. So just for the viewer perspective, I'm gonna try to take a little step back and make sure that people are following our conversation. Let's not assume that everybody's healthcare, right? The in healthcare is really complex, right? There's a exercise, delivery side, outcome, So the technology that I would like to focus on today is very relevant to what we do around patient access, right? And the role of technology is just huge, right? So you mentioned a few segments there for patients and the providers. But, from the patient perspective, right? The access has been so behind, and just past few years, I think COVID changed everything. Also, the patient access has been totally disruptive, and we start seeing a lot of good things coming out of it, right? At the end of the day, right, we all book, to go to favorite restaurants, right? Open table, right? And simple. And the even the booking airline tickets, it's pretty seamless at this day and age, right? But in healthcare, we can't have the same experience yet, right? So the role of technology is huge because we want to make your booking appointments as simple as open table, and we're almost there. We have all the. It's not really the technology is an issue. It's more like the regulations and type of thinking and the culture, and we really want to make it so seamless that every patient. Imagine every patient, right? They don't have to call anybody. They can just go online and book an appointment, as simple as that. But the key here is, right, the challenges. The biggest one that I can think of is the patient issue, like patient safety, right? How do you know that you need an appointment in a week? not right now, right? From the utilization perspective, if you don't know, if you're not properly triaged, if you're not properly assessed, you go online and book an appointment, and then you end up in the emergency room because you can't wait a week or even a day sometime, right? So that is the biggest consideration, and the triaging is something that we've been doing since the beginning of time, and it's really important when it comes to patient access, right? And then another challenge is providers, right? We want to focus on patients, right? Patient at the center of everything, but we got to take up the providers too, because providers are the ultimately taking care of us as patients. And if you make providers' life really miserable, it's kind of hard for them to take care of who they need to take care of, right? So they have their, we call it provider preferences on how they want to practice their medicine, right? They want to see when they want to see patients, what type of insurance they take, what type of patients they want to see based on the demographic, right? Pediatric, geriatric, anything in between, and then how they do their procedures, time of the day of the week. All those things are really complicated. Imagine, right? Permutations and combinations of these preferences that you have to address to make sure that they're getting the right patient at the right time at the right location, right? And it's also true for the patients, right? So again, back to patient safety, matching that up with the provider preferences. These are the major issues that we have to overcome, and that is why patient access is super important. And we can really use technology beautifully to be able to solve the problem.
Well, it's huge. I mean, nothing happens in healthcare, whether we're talking about the on the organization side to to be able to recognize revenue, submit claims for reimbursement, or on the patient side for achieving a better health outcome. Nothing happens until a provider sees a patient. And if there's a roadblock to providers seeing patients, or flip it in reverse to patients being able to see their provider, you're breaking down the value chain before you even get to step one. Like that isn't how it's supposed to be at all.
You're absolutely correct. Yeah.
And then looking at it from sort of the third party to this US healthcare system, we've addressed patients, we've addressed providers. What about the payer? What's the role of good tech in terms of the payer lens? We kind of sometimes leave them out on the side. We don't want to talk about them too much, but they're still an important part of the ecosystem here.
Oh yeah, especially in the U.S. healthcare, payers are huge, right? They're a big player. And again, I'm going to try to focus our discussion around patient access. Generally, right, providers, they want to make sure that patients are healthy. They are at the hospitals, right? And they want to make sure that, to be correctly stated though, they want to make sure that the patients are properly utilizing healthcare, right? If you have to go to the emergency room, you got to go because that could be life threatening if you don't do it, right? And if you don't really have to be seen, then it's good for you to stay home because you are overly utilizing the healthcare facilities and healthcare resources while other people might actually, need that, right? So again, back to triaging, the proper utilization of healthcare is really big for payers, right? That's why they exist. And, from patient access perspective, the payers can make a little bit more complicated, right? Going back to, getting the patients the right appointment with the right provider at the right care, right time at the right location, the payers play a huge part, right? Because we need to understand, right? Patients got to understand how much of that's going to be covered by their insurance, right? How much they have to pay out of pocket. The whole price transparency is huge right now, right? We want to be able to book all the appointments, right? The other day, right, I was trying to book an appointment for our anniversary, and it was, they just boom, while making a reservation at the restaurant, just give us a credit card, right? And it makes it so simple. And we want to be able to make similar experience for patients as well. And we need to understand, right, how much they're going to be paying out of pocket, how much they're going to be covered, and also the how much it's going to cost, right? And fundamentally, right, you don't want to be booking, okay, you know what, I just got my, knee surgery and I want to do a PT and I want to book, 24 appointments for next, a few months. And, we need to be able to help the patient say, hey, look, your insurance only covers such much, so you can have to this type of guidance, very intelligent guidance to make sure that they understand how much they're paying out of pocket, how much is going to be covered by the insurance, and also what's not covered. We want to be able to work with the peers and the clearinghouse to make sure that, again, they're getting to the right level of care without, all of a sudden, right, a lot of surprises when they see the bill, right? So we want to avoid that type of, trouble down the road.
Yeah, to take your restaurant anniversary dinner analogy a step farther, if you go out for dinner and you order a couple of steaks, bottle of wine, some salads, how much is that going to cost? Oh, we'll let you know when we give you the check. So, absolutely not. Like, how
That's,
much does it cost? Like, I don't need a
yeah.
surprise at the end of my dinner.
Oh yeah, that could ruin your anniversary dinner, right? Oh
Yeah,
yeah, the
no
dinner just
kidding,
cost
no kidding.
$5,000.
Yeah, hope it tasted good, honey, because we're eating out of the freezer for the next month. But to bring us back to a more, the topic at hand, a little more serious issue. Patient access. We're all patients. We're all consumers of healthcare to some extent, whether it's yourself personally, your kids, whatever. Somebody is a patient. It's not a commodity with patient access. There are very good experiences in getting yourself an appointment, and there are also very, very bad experiences in getting yourself an appointment. And just to illustrate the point, that might be a web form. And for us on the vendor side, on the technology side, is that web form secure? Where does my information go once I've submitted it? Is it going into
Yeah.
somebody's EHR, or is this just going into a WordPress CMS that has no security measures? So you have a potential HIPAA concern. Not to mention the back and forth, phone tags, emails, we can go all the way down the line here. But the point I'm trying to make is that it is not a commodity. It is not a standardized process to get to the end of that access or to pass that access hurdle. So, what's the importance of an exceptional patient experience from the viewpoint of a healthcare organization when we're talking about access?
Yeah, so this is a really good segue here, right? And let's describe a couple of bad examples about the bad patient experience, right? A good example of bad patient experience. There are a lot of people, right? They go online, and because of COVID, everybody's adopting technology like crazy, right? We have staffing issues, we have shortage of the clinical people. So as a system, we finally realized that we need to rely on technology. And it was a wild wild west. Just people just throw out random stuff, and nothing has been thought through clearly, elegantly, and holistically. So most people think that okay, just put pretty pictures of a provider and create a little beautiful profiles and have patients book. So we started seeing a lot of drama from the patient's and provider perspective, right? The patients show up for back problem, and then the physicians go, "Oh, I don't do any back. Why are you even here? Oh, I just booked, online on your website. Well, I can help you. I'm a knee guy. I only do knee and ankle, right? So, those things are so common. These are the frustrations that we hear from providers on a daily basis. And then same thing, right? Somebody's calling, what? I have blood in urine. And the color is, bright red. It's like, red wine. Yeah, yeah, yeah. You know what? All the people who see that are totally booked till January next year. So we're gonna see you in February, right? And that person ended up in the ER, right? So again, back to access and triaging, and right, this could be life-threatening if you have a really bad experience, or such a waste of time for you and the providers, right? So again, this is going to be the type of thinking requires a systematic approach and also a very holistic approach to create a very compelling, exceptional patient experience, right? And this is where we talk to our clients about, right? Look, you have to build trust with your patients, and the only way that you can build trust is consistency, right? When you're calling to book an appointment or you go on a website to book an appointment, that experience have to be identical, right? The experience has to be guided by this central intelligence that properly triaging, properly calculating and matching with the right provider at the right time, at the right location. And again, it has to be all holistic so that the patients, right, whatever channel that they want to use, they might be texting you, they might be going through the IVR, they might be going through your website and book an appointment, or they might be texting you, right? But they all have to end up at the same outcome, right, with the provider that they need to see and when. And that is the only way you can gain trust from the patient experience perspective. And once you gain that, patients not going to forget that compelling experience, right? This is where you can have repeated customers coming back over and over again, and they're just gonna, they're gonna remember. You know what? Booking for the appointment is so simple and so accurate, and next time they're not gonna even think about going anywhere else because you build trust with that patient, right? New patient versus existing patient, and that is the type of exceptional patient experience that we're trying to create for our clients. And it's a lot of work, right? A lot of people, they think that, you know what, I'm going to buy something, turn it on, turnkey, and wait for magic to happen. It doesn't. It doesn't. You get what you put into. Right? At the end of the day, it's just like your workout or your discipline or whatever you want to achieve in life, right? You get what you put into. If you're afraid of hard work and if you're afraid of, committing resources and making things happen, you're not going to move the needle, right? That's why we talk about, it's very provocative. We say, who cares, right? You have to care. If you really deeply care about your patient, you got to put in work, and you're gonna have a great outcome. And if you don't feel like so and so, if you're not too sure, then let's not even go to that route, right? You're gonna be a mediocre, and you will never be able to provide that exceptional patient experience. It'll be a dream. You would never be able to realize that. It's a lot of hard work, and it all depends, right? How much you care about your patient, and if you show that you care, they're gonna actually stick with you, right? Your retention is gonna be huge. Your new patient acquisition is gonna be huge. And if you don't care, tough luck, right? Now, I mean, you mentioned the consumerization, right? And they have choice now. They have a lot of choices. They have a lot of options. And it's just, consumerization is already here. So, you got to take that into a big consideration, right?
It's been really interesting to see that push because going back to pre-COVID and way before the No Surprises Act, there's a big push for price transparency. How can we get it? As a patient, I want to know what I'm going to pay, and the people that cared, to use as you said, who cares? The health systems and the practices that cared made that happen. They made that a reality for their patients. And then you get to COVID, and you get through the first 90, 120 days of the pandemic proper, I guess I should say, where patients need to be seen by their provider, and patients did a really good job of kicking and screaming, saying like, telehealth, I don't care. I'll pay cash. I need it to be easy. I don't care how I'm going to see you. FaceTime on my iPhone, even. And, regulations were lifted to allow for the treatment of patients. But I view that as a really positive development in the consumerization of healthcare because patients demanded something.
Yep.
The consumer, they got it. But that doesn't mean that everything is hunky dory. There's still a lot of ground to be gained to be able to treat healthcare like a true consumer product. What's your stance on that?
Yeah, definitely. So, you were spot on the regulations, right? The regulations, I totally agree. We have to protect, the health information, right? And at the same time, right, the COVID, just again, we're all over the place, right? FaceTime, Skype, and people were taking pictures of all the interesting parts in the body and sending to their, texting them to their
Right, right.
providers, and desperate times, desperate measures, right? They got problems that they have to address. So I get that. Moving forward, though, we want to really consumerize healthcare for patients and make it really simple. At the same time, we want to make sure that we're protecting their privacy, right? So it has to be a fine balance between innovation so that we could personalize the patient journey while protecting their privacy and their, again, it's a healthcare is very sensitive, right? And recently, there are a lot of attack going on in healthcare. So we have to be vigilant, right? This is the conversations that we're having with CIO and CTOs across the country because they are more alert and cautious than ever, right? So we get that. But at the same time, we really have to, now is the time to really consumerize the healthcare experience for patients, right?
Now is the time because, as you pointed out, you will be losing patients shortly. You will be needing to consider selling your practice to the health system because you've lost so many patients if you're not taking these demands seriously.
Yep. And also, healthcare is another problem is in addition to regulations, right? Again, we be able to find a right balance. Two other problems around like a barrier for consumerization is healthcare is pretty fragmented. And at the same time, healthcare is very monopolized by a few players, right? I mean, you came from healthcare world and you were in the EMR market, so you know that really well. The fragmentation is not necessarily a bad thing, right? If we all follow standards and if we all follow the industry best practices on data so that we could exchange, meaningfully for patient care, right? So, it's in a sense that the orthopedic and oncology, dental, these little subspecialties, they have very, very niche products that they use. And sometimes, you don't, as from the entrepreneur perspective, right? We want to bring everybody together and create a compelling journey for everybody. But, the barriers are just fragmentation, right? So if you were to start anything in healthcare, right, what I like to recommend is the interoperability, right? And whatever that you're doing, right, the data is important, whether it is on patient data, health data, billing, outcomes, imaging, whatever that might be, right, that has to be shared easily with the stakeholders and patient themselves in the healthcare, all their apps, all their value-added services. It's just so important that we follow standards in healthcare, right? It can't be in a la la land, people just doing whatever they want to do, and nothing is, interoperable, right? That's going to be a nightmare moving forward. So that fragmentation, although, the competition, having a very competitive market is good, uh, but at the same time, fragmentation could hurt patient care, right? And on the other hand, right, monopoly, right, people, a couple of big EMR companies, right, they need to understand that, they're making their customers drink the Kool-Aid that, oh, we are everything you need in the world, right? From anything under the sun, we can take care of you. Right? That's not true, right? There's so much innovation going on and so much creativity, and the brilliant minds in healthcare are coming up with some really amazing solutions. And if you're telling your customers that we're all you need, you don't need anybody else, that is actually making patient care miserable, right? So they have to be also open-minded and they have to let the innovators come in and work with them. Other than like, everybody says that, oh, the patient at the center, everything is around patient. Again, who cares, right? That's why we have this community group called Who Cares? Because we care, right? We want to make sure that when you say that you care about patients, let's really show, right? Not just don't just talk about it. Let's do it,
Prove it.
right? Prove it, right? And how do you provide this exceptional patient care? So for us again, right, around patient access, and can you actually prove it, right? So that's the what we like to see. And so back to the monopoly on just telling everybody that we can take care of you, that is far from reality and far from the truth. So, right, educate all your customers. Think about patient care for real, and let's try to find calibration, a true partnership, and true interoperability to make sure that patient care is the real deal and the patient care is the center of everything. right? So we have a long way to go for that. For now, people have this. I mean, a lot of the EMR companies. I don't want to blame the monopoly. A lot of the EMR companies said, "Oh yeah, we want to do it all," and they claim that they have all the interoperable stuff, but deep down, right, they just want to do it all, and they want to just, kind of kill the innovation and creativity. Just want to maintain that control, right, which
And,
is not good for patient care.
and Oakkar, what they're killing is the physician drive to remain employed as a physician. When you look at any data from any source, whether it's class research or the AMA or any of the specialty bodies, the number one self-reported factor for burnout is health IT. Who delivers the bulk of health IT, and it's the EHR vendors. So we certainly don't want to,
Yeah,
disparage people doing good work in EHR land, of which I know
yeah,
happen to know many of them. We need to be realistic about it too. That we are approaching a cataclysm in U.S. healthcare. We are not going to have enough physicians, not enough providers. We're already feeling the crunch to some extent with anesthesiologists, but before the decade is out, we're going to be under that critical mass of physicians to treat enough patients. And one of the biggest problems is the healthcare technology in use, the legacy vendor, right? So when you make the point that the legacy vendor, meaning EHR vendor, needs to walk with partners, that's obviously what both of our organizations do. Is we're not striving to be the next great EHR. We're striving to ease physician workflow. We're striving to ease patient access to their provider. So I'm a little bit on my soapbox here. I don't mean to steal your thunder, but it's a very
no, no,
important
no,
point, and it's
yeah,
one that can't be overlooked because there is a very clear issue with healthcare in the U.S., and it is the legacy technology being used.
yeah, you're right. And they're not really designed to create, right, omni intelligence, AI driven, you know, the recommendations for patients to, get to where they need to go, right?
Right.
I mean, EHRs are super important, right? But there's going to be a lot of very powerful value-added platforms going to be, sitting on top of EHRs, and all the, the EHR vendors, they have to be okay with that. They have to really adopt, work with other innovators, and let's disrupt the healthcare together for patient care, right? Not just, I want to just control it all, have it all, do it all, right? That's a bit greedy, right? That's a bit greedy, and it's not good for patients, and it's not good for the providers either, right? They just have to stop preaching that, for people who are, in a leadership role for healthcare organizations, right? They have to be a little bit more. I don't want to say skeptical about these Kool-Aids, but they have to be a little bit cautious and right common sense here, right? So we're trying to educate what we can to our clients and to who cares initiatives. And like again, your platform is so powerful. So grateful to be part of it. We're doing what we can to spread the message. Again, we got to care about patients, and I'm a patient myself, and I take care of my family, right? So going through that journey on our own, right? We know that there are a lot of things that we can improve.
Well, and to that point, to bring us back on topic here, I like your phrase, who cares? Sometimes I care a little too much. Sometimes we get a little long winded discussing what ails us. But there are a lot of really positive developments around the consumerization of healthcare for patients, for consumers of the service. Everybody wants it, but I'm not sure that everybody could really tell you why they want it as a patient. So, in your words, why does the consumerization of healthcare matter for a patient, for you and me?
Yeah, I feel like patients been kind of ignored in the equation for decades, right? Recently we start calling consumers and customers. Back in the day, just when we started the company, just patients, and they were never in control or have say in even their own healthcare, right? So consumerization, now it's patients are getting very vocal. They have a lot of choices, and they're switching providers more than ever, right? They are like, you know what? I don't want to call, and if I can't find what I need online or on my phone, then I'm going to go somewhere else, right? So again, COVID changed everything, and also the behavior, right? As we have more and more new people, not new, younger people coming in, they are very they like to use technology to do everything, right? So it's it's inevitable now that we have to really focus on consumerization and trying to do everything. And it's at the end of the day, the patient's gonna do what's best for them, right? From the healthcare perspective and from the financial perspective. And consumerization means having a very guided approach and very transparent, and then also very trust-based guidance to get them what they need will win the race, right? So you can just, back to my point a little earlier, you're like, all right, we have to consumerize everything. Let's, deploy a bunch of disconnected technology solutions all over the place, and the patient's gonna stick. No, they're not, right? And consumerization means building trust. Consumerization means building consistency and also the repeatability. Uh, and if you can really truly do that holistically, then the patient's going to be coming back to you over and over again, right? So for me, that is a true consumerization, right? That's like you can think of, Amazon Prime, right? How crazy is that? That you order something that you know that it's going to be here at the door the next day, right? It's crazy, right? It's that, and then if you're on Amazon Prime, why would you ever leave that, right? That's the type of trust that we need to create. Whether you're, just ordering from your phone or from your computer or with Alexa, it doesn't matter, right? It's going to be at your door, regardless, and it's just so predictable, right? That is the true customization that we want to create, right?
Yeah.
We
Uh,
are almost there.
Prime is the perfect example. And then, not to drag us too far off track, but what will be something that I'm watching or that I find interesting is there is very much a generational divide in how you would define ease of access to healthcare, right? Like we have
Yep.
so many baby boomers and we're, hopefully going to have them for a long time. That generation can certainly navigate technology. They've got iPhones, they have Prime memberships for that matter. You pick up the phone, I got to make an appointment, I'll call my dermatologist, I'll call my primary care guy, whatever. That's fine. That isn't going to be satisfactory or acceptable as Gen Z starts to become in charge of their own healthcare. You're seeing that to some extent with millennials, though that's kind of like kind of straddles the technological divide to some extent. It almost seems to me that if your healthcare organization is not undertaking steps to make access very simple and digital, you will be due for an extinction level event at some point in the not too distant future. And that may be a little bit dramatic, but just think if your primary source for patients decides that they're going to go next door because they can use their phone or use an app to create their appointments and then go see their provider, that means there's no revenue for you that chose to keep their phone bank active or whatever the case may be. So this is a little bit out of my area of expertise, but curious your thoughts on this. As we pass through time and new generations sort of become the prime stakeholder for their own health.
Yeah. So I think the cost is a big factor for them. And it's kind of crazy that, more and more people are also, having high deductible insurance plans, right? A lot of them are just, they don't want to deal with the insurance completely already. They just want to like, all right, out of pocket, right? And they might be making a lot of money, but they just don't like that. You know what? I can only go to certain, providers, within my network. So what we're seeing here is, right, we set up patient self-scheduling across the country, right? We help our customers with their contact centers. So we have, very specific healthcare specific CRM, customer relationship management that runs on all the call centers. So we've seen the data, the patients are, getting really, really, especially younger patients. You know what? I see who I want to see when I want to see them. And then, of course, with the, guidance on their safety and I don't mind paying out of pocket, right? and high deductibles. So that trend's going to continue, right? So we have to really ready for that generation to be able to choose you as a healthcare provider, right? And so they are, for them, that's far more important than, oh yeah, you know what, I have whatever health insurance plan, and I'm gonna stick with the whatever comes in my network. I think those days are gonna be pretty gone in the near future, right? So it'll create a really competitive marketplace for healthcare providers. And I'm a big believer, right, that the healthcare providers should stay independent, other than getting gobbled up by a bunch of healthcare systems, and they get a little bit, too much bureaucracies, right? So again, that's like a lot of admin and bureaucratic stuff that takes away from patient care, right? So I'm a big believer that people are really trying to stay independent, trying to thrive in that environment is awesome. But one thing that you have to keep in mind is consumerization, right? You have to consumerize everything for your patients and make it super simple for them. And again, trust building, right? Consistency. You have to be thinking years ahead and do everything holistically, again, especially around patient access. And if you can do that, that generation of patients will be just flooding in your gate because that's what they're looking for, right?
I'm with you there. So along with consumerization of healthcare, obviously that's a fight that's being fought, continuously, but sort of a new entry to this healthcare arena is AI. And whether your stance is that it's so-called alleged artificial intelligence or just really sharp machine learning, it's a hot topic. What are you seeing on your end of things, Oakkar?
Oh, Eric, it's my favorite topic. And, we've been doing this since the very beginning. And, imagine 12, 13 years ago, right? We were talking about machine learning and AI and, the predictive analytics, and people thought we were crazy, right? Oh, and you're in healthcare, you're going to kill people. Fast forward 12, 13 years later, right? We're doing this and, we could do this better than anybody else right now. It's just, yeah, it's just such an exciting time to be in healthcare, right? I'm sure you heard about the LLM, the large language models. The thing is, though, you can't just use a public domain to build LLM for healthcare, right? Healthcare is rightfully so very fragmented, right? You're gonna have to have a bunch of models. For us, right? When you think about LLMs, urology, orthopedics, cardiology, women's care, pediatric, right? These are totally different set of problem domains, and the patient demographics matter. These specialty matters, and there are a lot of other facts that are going to be matter to be able to just in a not even a care delivery, right? Just from the patient access perspective. So, we're not going to say, oh yeah, just use your GPT, LLM, and just customize the model. I can warn you, I've tried that already, right? That's what I did in my grad school in all around healthcare specific machine learning, data mining, AI, natural language processing, just trying to have the generic model and customize and hope that you're going to get the great outcome. I can save you like many years of pain and suffering. That's not going to work, right?
Right.
So, back to the regulations and such. So it's really hard to build LLMs for healthcare, and again, it's even harder to build LLMs for a specialty specific type of models, right? And we've been doing this for a long time. I don't want to reveal too much, otherwise, my CTO is going to yell at me. But we've been doing this for many years, and the future is going to be pretty amazing, right? Again, trying to harmonize the whole patient access as in a one umbrella, whether a patient's going to be calling you, they're going to go through the IVR, they're going to go through the app, or they're going to come to your website. It'll be all guided by this, very powerful central intelligence that knows everything about the operations, right? That knows your prescriptions, right, inside out, all the rules on that prescriptions. And then did there any additional use case comes up, and the system can, do a probability and gonna get you right the most probable pathway to get you what you need, right? Same thing with scheduling, same thing with triaging, same thing with building questions, right? Same thing with, I don't know, anything that you can ever imagine. Imagine that we have really powerful intelligence on specialty, and we can do a lot of powerful recommendation for patients, right? And it's not going to be in healthcare. It's not about, okay, let's put a little AI chatbot and doesn't know anything about your practice, right, or organization, right? Hi, whatever, and it's going to have a mediocre natural language processing, and it means nothing, right? Healthcare, we spend so much, we waste so much in technology that it's not really impactful for patients and providers and the staff, right? So we have to think holistically. I use the word like maybe I'm overusing it to be able to bring real value to the patient care, right? So that's what we're trying to do. I think we are like on the verge of something like magical with AI, but we got to go through a few things to make sure that LLMs are super fine tuned for start out with the specialty, right? And then for the particular practice, and then trying to just deploy with just unbelievable patient experience across the board. Again, call, text, IVR, right? Apps, websites, whatever. That's gonna be pretty cool.
And it feels like we're so close. If you pay attention to the health IT news, there's a lot of sort of chat GPT, a problem in search of a solution. To your point that these models need to be very specific, very highly tuned to a specific issue. Did you see that in the last 2 weeks in the UK, they put chat GPT up against the NHS general aptitude test and it bombed it. It wasn't even close to passing. It got a D
Yeah.
minus and the average grade is like a B. So
Well,
if,
I'm not surprised. Yeah, I'm not surprised. I'm sure you're not surprised either, right? It's
no, I'm
very
not
specific. Yeah.
I'm not surprised either. And the things that were a little surprising to me, going back to some press releases from HIMSS earlier this year, is the embedding of ChatGPT, not just an LLM, but of ChatGPT proper into electronic health records. As a patient, I'm not sure I love that, and as a provider, I think I love it even less because we're not talking about treating a patient with an LLM. We're talking about responding to a patient. We're talking about generating documentation using an LLM. And the thing that goes back and forth in my mind is that I'm a provider. I already don't like using any of the technology, most of the technology I'm forced to use, because it takes too long. I'm wasting my time with it. So now, sure, I can click a button and generate text. But who's going to review this for me? It's not.
Exactly.
It's not just done there. Who's going to read it? Is it going to have to be me? Yeah, it is. So I'm excited for what the future will hold. The examples that you've given are meaningful, are powerful, are applicable, as opposed to look what we can make this LLM do. Like, oh,
Yeah.
okay, well, it's like a monkey doing a trick at the circus. Like, congratulations, it doesn't change anything in healthcare. And on the, not to sound like I'm a total negative guy around AI in healthcare, the other one that's kind of fresh in mind is New York University's NYU-tron, where it's able to scan handwritten notes and generate structured data out of unstructured data. That's cool. That's powerful.
That's
And that makes a
very cool.
difference.
Yeah, that's very cool. Yeah. And a lot of people, so Eric, to your point though, a lot of people are trying to look for use cases to use, generative AI, GPT, but I think a proper way should be trying to find a real pain point, right? Real business problem and care delivery problem and access problem. And, that should be part of the solution, addressing a real pain point, real problem, other than trying to find little use cases here and there and trying to find, technology to fix your use cases. It's not very sustainable, right? And you're not going to get a whole lot of value.
Now,
So, we know our problem, right? We want to attack that problem, and we're using AI as a tool. And we have very specific, very difficult problems to solve. We're almost there. right? And we're already doing that, not in the LLM perspective, but we have, machine learning, AI, all kinds of really sophisticated, AI assisted stuff happening in our platform already. And it's going to be next generation, right? Once we figure out the specialty pieces and very, you know, uber personalization for each practice, that's going to take the AI to a whole new level.
Love it. Love to hear it. Well, we've got to have you back on when that's released. You can tell us all about it. Is that fair?
Love to, love to, love to.
And then with that said, Oakkar, is there anything else we wanted to cover that maybe we didn't get to?
Not really, Eric. It's a great cast, and it's just so happy to be part of it. We discussed a
Yeah.
lot, and hopefully that's pretty useful for the viewers.
I know that it will be. This has been a fantastic 50 or so minutes with you. On our way out the door here, how can listeners connect both with you personally and where would you point them to learn more about Keona Health?
You can go to keonahealth.com, and you can find me on LinkedIn and Twitter. My handle is just all Oakkar, Oakkar, and I'd love to hear your thoughts and feedback.
Yeah, listeners of the DocBuddy Journal, be sure to connect with Oakkar. If you have any differing takes, I know you and I, Oakkar, we ended up on the same side of LLMs and healthcare, I think, for the most part. If you're listening to this and you're punching air going, these guys got it all wrong, tag us. X, or the artist formerly known as Twitter, would be a great place to do it. We're DocBuddy app. Oakkar is now x.com/OAKKAR. We'll keep Keona Health out of the dogfight for you on that one.
I'd love to hear it. I love disagreements. That's what, that's makes you really fresh and also see different points of views.
Yeah, that's just it. If you look at them the right way, you can get better from a disagreement, and that's sort of a lost art these days to be able to hold an opposing view in your mind and not have it offend you. So we'll welcome that as well.
Awesome.
And with that, Oakkar, thanks for joining us. This has been a pleasure on behalf of the entire DocBuddy team. Thank you for listening. Be sure you're subscribed on Apple Pods, Spotify, and YouTube. Until next time, I'm your host, Eric Sunset. Talk to you soon.